Julia. So about weekly here at Art of Skin MD, we're going to spend just a few minutes because we know your time's valuable, but we also want to know you want little nuggets of information. We thought we would feature myself and another one of the providers here at Art of Skin MD and talk about either like a topic du jour or something we're kind of expert in or passionate about.
Yeah.
So we thought a great opportunity we talk about is something that I've been doing kind of an analogous procedure on called InstaLift, but you are a real expert on some of the thread lifts. So we thought that would be a great opportunity now that we're featuring this, and we've actually already started treating several of our patients. We actually had one in the door today. That looks fabulous, coming in for second round of 3. But let's talk thread lifts. And I know you've got some great diagrams, and we can actually show some of the devices too that we're using during that procedure. So you know, I think there's a lot of misinformation about thread lifts. So what are they? Like, what are they made out of?
Yeah.
What's the purpose of them,
What's
Julia?
the background? Absolutely. So hi everyone. For those of you who don't know me, I'm Julia. I'm one of the PAs here. And I've been performing thread lifts for several years. They're one of my favorite procedures. Historically, I think that threads have gotten a bad rap because when they first came out, they were non-absorbable. And with the procedures were, happening, people could have some complications from that type of thread. But the threads that are used now are called PDO threads. They are made of a biodegradable product. So it is a suture that has been used for over 30 years in cardiac surgery, plastic surgery, very low reactivity, very high tensile strength, so it is able to hold the tissue and reapproximate the tissue, and it's not many people react to them. So they're a great option for people that want like a non-surgical option to give a subtle lift to their tissue. A great way to kind of measure if you're somebody who might benefit from this is if you're like me, or I'm sure Dr. Palm, and you look in the mirror and you kind of go like, what would happen if I went
A little
like
tweak,
this?
a little morning tweak in the mirror.
And you're like, yeah, that would look really good. Like that, that's kind of an example of what threads can do. And they're not a replacement for surgery. I think that that's also part of what gave them a bad rap is people calling them non-surgical facelift. And there's really no such thing as a non-surgical facelift if you need a facelift. But if you're somebody who has mild to moderate laxity, and in some cases I've seen good results with severe, but we really have to have that consultation and decide if you're a candidate and what the results would be. They can give really great results. I have an image here that shows kind of what the different threads look like, and we specifically have brought on Nova Threads, which is a company that makes different types of threads. I think another, not misinformation, but just confusion, some people have about threads is that the only type of threads that can be used are the bigger barbed threads, but I actually have really beautiful results over time with different smaller threads. They're an easier procedure, and they're great for some candidates that maybe you're not a filler candidate in an area, or you're not necessarily even a sculpture candidate in an area based on the muscles and the anatomy of the area that we're looking at treating. And so they really kind of come in to complement some other procedures as well as a standalone treatment. So it's not uncommon for a patient to benefit, say a typical patient will come in and maybe they need a little bit of skin tightening. There's always a component that you can benefit from that. Maybe they do need some volume replacement, and then we kind of give it like the cherry on top with a little bit of the thread lifting to take away, you volumized areas. You don't want to continue to add volume to like lift the tissue. That creates an augmented look. Threads are a nice way to come in and give that natural looking feature to your anatomy while still giving that a little bit of that lift. And so if you guys can see this image, this is an example of what the different types of threads are, and this is really blown up, so I actually have some real threads that I can show you.
A little bit here while you continue to talk. So there's several different kinds.
Yes.
So I think, like barbed and smooth are sort of how we can categorically talk about some of these. So maybe explain the difference between the two and what they're doing for tissue.
And so I actually don't think this one has the feature of the barb. So here's a good example. So I'll hold this a little closer and let me know if you can see okay. So the threads are, basically manufactured with different features. They're different sizes, and they're designed to do different things. So certain threads are designed to what we call barb threads. You can actually see their tiny little barbs cut into them in the factory, and that is designed to adhere to the tissue. So it helps create a little bit of that lifted effect. There are also threads that help with collagen remodeling and help with volumizing. So you can see this, it's not called a twist thread because it's literally twisted around the cannula. And then there are smooth threads, which are single strain, so they don't have that twist component. Smooth threads are really great in areas that we're looking to just build a little bit of collagen, but not necessarily volumize. So I will put those sometimes in the little preauricular area, like in front of the ear here if you want a little bit of volume. Sometimes they'll use those above the eyebrow if you're just looking to kind of build a little bit of that tissue that starts to thin as we age. And then the twist threads are great if you want to actually get a little more noticeable volume. These are not a replacement for filler, so for patients that really need filler and volume, of course that's what we'll recommend. But if there is an area where you just have little creases or you have a little bit of that volume loss, these are perfect.
How about these barcode for dreaded perioral lines?
Yeah.
Like that's something you can do if you're even seeing somebody for a neuromodulator treatment, so toxin, Botox, Dysport, Daxify, whatever. Xeomin, the neurotoxin du jour that we're using. But that's something, I mean, you can literally do a couple of these smooth threads on either side, start to build collagen. It's not something that has downtime for patients. Whereas when we talk about these barbed ones, similar to Instalift, which I've been doing, gosh, for 7 or 8 years probably, maybe even longer. It's hard with COVID. I sometimes forget duration of treatment of what we've been doing things. Those help with vectors of lift, right? So in the same way, good facelifts that are done today, we're looking at vertical lift, we're working against gravity. This is a way that we can help tissues sort of reorganize itself, give a lifting effect, and be an excellent complement to some of the other skin tightening or volumetric strategies that we're using in the office. So you had mentioned fillers, you know, if somebody is truly volume depleted, like we need to make sure that that is in place first before we're doing some of that. If somebody just really is devoid in some of, you know, has severe skin laxity, it's probably not the best treatment for them. But the sweet spot is maybe somebody that's not quite ready for surgery. They want a visible change. They can deal with a little bit of quiet downtime if we're doing some of the lifting threads. And they're okay with seeing you for a couple visits and sort of gradually manifesting changes over time. So what are some of the like problem areas on the face that you feel like we address the most consistently with thread lifts?
I think almost everyone is gonna go like this when they come in and say, you know what, this bothers me, this bothers me, this bothers me, and that's where threads really shine because they're able to help. You know, we kind of when we do an assessment, we'll say, okay, what happens if I get a little bit of a lifting here, a little bit of lifting here? So the bar threads are usually focused with entry points that we make, and so I'll kind of show on Dr. Palm what. So pretend, and I'm going to switch sides, and hopefully you guys can still see. Pretend Dr. Palm is coming in and she's flawless and there's nothing done. Pretend she does.
Well, because we do everything here, right?
You know, I would assess and I would say, okay, you know, I can see if we do a little something back here, you might see a little improvement in the cheek area. If we do a little something back here, a lot of times people have a little fullness in their submental region or underneath the chin, and we'll make kind of draw out a plan. Make entry sites that are really small, just a little poke of a needle on the edge of the face, and those are where the threads are inserted. And I'll show you what the thread actually looks like. So they come pre-filled on a cannula. So the end is blunt, if you can see that, and the thread, this is what's inside. And if you were to actually pull the thread out, I would love to show you guys kind of the thickness of it, because I think this can be intimidating to people, but really this is what it looks like if you're able to see. And you can actually see the little tiny barbs. And that goes underneath the skin. And so we're kind of strategically placing this in certain areas to help elicit a little bit of that pullback effect. Then what we will do is place smaller threads. So these are called twists. This is a sample I showed you to show you if you can see the actual coil on here.
Itty bitty friend, right?
Little tiny guys. And for some people, this is all they need, or this is all they're comfortable doing. You can still see an improvement in your skin from doing threads. So threads can even give a little bit of a glow and just help with tissue quality. And so those would go maybe in her mesolabial fold. I treated patients in their like glabellar line.
Yeah, what if they're concerned about risk of fillers? This is something that we can do that's really helpful in a higher risk region.
So it's basically, what she's referring to is the vascularity that exists in the glabellar region is a higher risk for complications from filler. So historically, that was treated more often. Now we really kind of stay away from treating that area on most patients. This I've had great results with for patients where I'll actually place a couple of these threads in their deep glabellar line, paired with like a neurotoxin, and over time that skin improves and thickens, and the crease that's in that area fades. So it's there's a lot of creative ways, and I could go on and on about all the creative ways, but really if you have like a skin crease or fold that bothers you, if you need a little bit of subtle natural looking volumization, if you have skin crepiness, sometimes we'll do that on the body, similar to how Dr. Palm does a lot of her sculpture treatments. It's going to help stimulate collagen, help kind of with those little fine lines or crepiness. So that's a great way to use it as well.
So and you know, we often combine this with other things. So we want to relax areas. So if we're treating lower face, most of the time we like to do a wash of some sort of neuromodulator just to soften the platysmal band so that we can get the most lift, and we've got kind of a quiet field for you to allow these barbed sutures to do their amazing stuff, or threads, excuse me. And then in addition to that, there's sometimes we're doing fillers, so we like to volumetrically get people to a good place first, then do the thread lifts. Neuromodulator probably first, so it's quiet before we place the thread lifts. If you're interested in M-Phase, which is a muscle toning device we do a lot of, I would recommend doing that first, because we don't want to contract the muscles and then have threads in place that we're possibly displacing, which isn't harmful. You just lose some of the effect from things. And then in terms of old therapy, which is an ultrasound-based skin tightening, non-invasive technology where we can see tissue in real time, how do you like to space those if you're considering both a little bit of thread lift and something like a skin tightening technology?
As long as you're performing the skin tightening or like the M-Phase series beforehand, there's really minimal downtime or recovery from either of those. So I typically will say it's like a person, coming in and they just want a game plan to plan their timeline. I'll have them do neuromodulator at the consultation, or potentially at the first appointment. All therapy, I would give it about 2 weeks after having that treatment, just for any residual kind of discomfort or swelling to go down. It's very minimal, but if there is any, that just feels good to have that go down before you come back, and then you can treat. And the nice thing with that combination is the all therapy takes time to show results. So over time, you'll see an improvement in your tissue just from that, and then you're also getting the benefit of the threads. As these threads break down, they produce collagen, and that it's like the gift that keeps on giving for both of these. So you feel like, okay, I look really good when I leave the office, but a month later, I kind of look better. And then a month later, I look better. And we actually, because everything that we do here is so results focused, we are unique in the sense that we offer a series of thread treatments in every package that we offer. So instead of just having you come in one time for one session of threads, we actually game plan a series of 3 visits. Not every visit is the same. The first visit that you have, you're going to have more threads placed. That's kind of like your preliminary treatment. You come in for a follow-up about 6 weeks later, and we place another few of those little small threads just to help with kind of like that scaffolding effect. And then you come in about 6 weeks later, and we place any kind of final threads needed for that, where you need it. So say you still see a little bit of laxity in the submentum, you don't need your full face threads done again, but we place a couple more in that area. And that, along with what Dr. Palm was referring to, is making sure, like, if you need volume, you have volume. If you need a little bit of the muscle stimulation, you need that. We put together those customized plans so that these results can last. So it's another concern I've seen in the past with patients is that these are so temporary. I'm not going to see results last. When you really kind of put the whole picture together and address all the components of aging that are happening for each unique patient, that's when you'll see the best long-lasting results. So when you're addressing the skin changes, as Dr. Palm mentioned, that the little fine lines around the mouth, sometimes you can address those with filler, but if the skin is thin, you need something more that's going to be able to truly boost collagen versus just putting a little bit of something in that space. And so that we can get the results to the next level with some of those options.
So I think, probably some of our listeners or people watching this playback have seen the quite outrageous and pretty sensational photos where you literally see dozens and sometimes like 100 of these little small, it's the smooth threads, it's not the barbed ones, that they're putting in here to help stimulate collagen. And what do you think of that? And is that like what you're doing here in this clinic?
I think a lot of that is for the Instagram show.
Yeah.
I think that
it's showy and it's definitely an attention grabber.
Yeah, I think that you can see a great result. You don't need that many threads to see a great result. I think in some cases, people like the extreme, and there's always going to be the extremes, that are around. Majority of people don't need that many threads. They don't have to look like that in the office. I usually put one in and take it out and just kind of keep it really simple. Bruising is possible, but it's a pretty gentle procedure in a lot of ways, so it's not likely, but that's, you might have a little bruising and swelling after. Things to kind of socially plan for. After the barb threads, you will feel a little bit tight, and you can feel a little bit sore after that visit. So whenever you have a plan to have those placed, you just want to take it easy the first 1 to 2 weeks. Ideally 2 weeks if you can be a really good compliant patient, avoiding like biting into big apples, any hard stomping, impact exercise, anything, you don't
no
have
opera,
a dental,
no crazy laughing with
with
a romantic comedy, don't do acrobatic yoga when you're upside down, all
yoga,
the things.
No. But those are things that we'll go over with you in the consultation to avoid. Obviously your medical history, make sure you don't have any contraindications to the procedure. But it is a very well-tolerated procedure. I think in the right candidates, it's been a very high satisfaction procedure. In my experience, Stephanie also has years of experience doing the procedure as well, and that's what Dr. Palm felt comfortable bringing it in, because we both are very comfortable with the procedure.
Yeah, I think that's great. And I think there's a lot of talk about some of the temporary fillers, temporary sort of dissolving devices that we use, such as thread lifts. And I think the guidance is, if you are considering a facelift or a neck lift, if you have absorbable sutures, we usually want you to wait about a year before considering a surgical intervention. And these things have become quite sophisticated, and if you're in experienced hands, we're putting it in the correct plane. So things like puckering, things like extrusion of threads, discomfort that should not be present because we're in the wrong tissue plane, has really been avoided. It's actually a pretty comfortable procedure because as we're gliding the suture, our thread material through, it is, it's in a plane that's pretty devoid of nerve endings, so it shouldn't hurt. We do numb the entry points, so that makes it really comfortable. And because we've had like a decade to play with these in real time, we now are quite sophisticated in a pragmatic approach of how to best volumetrically and vector-based actually raise the face. So you're primarily working from an entry point around here, which helps with some of the sort of fascial planes and fusion lines of areas that are really important that facial plastic surgeons are thinking about when we're actually doing procedures. And then also working in the lower face to help again in that same sort of plane and to get safe results that are long down the road. So again, just to summarize, these are really cool procedures. I'm so glad that we're offering this. So like we said, we had a patient today that they were in treatment 2 out of their 3. So usually our first one is a combination of these barbed threads along with some of the smooth. Usually the second session, which is 4 to 6 weeks apart, we start putting in some of the smooth ones to help with the collagen matrix a little bit. And then the third one is kind of a tune-up. It's a little bit of a hybrid. Between the first and the second session, you're probably putting in some barb for structure and for lift, but also doing that third session of some of the smooth to just help collagen matrix, help textural issues, and fine tune a little bit. And then maintenance wise, when do you like to see patients back?
Usually we're seeing you for a neuromodulator every 3 to 4 months, so that's typically the timeline. If it's a consistent patient that's on top of their regimen, I would say we would see you anyway and just kind of check how things are looking. If you're somebody who is only doing a thread procedure and you're not having any other treatments, I would say come back at about 3 months and check things. And your results should really last about 8 to 12 months. So you might not need anything else done, but it's good to just kind of check the final results, see how things look, and then plan for at least once a year. We might need to do something. It might not be the bigger package you started with. You might need a smaller package to kind of maintain, but that's assessed by person.
And then last question, because that was so popular several years ago with these cat eyes and the brows. So tell us your thinking, because I think all 3 of us, Stephanie, you and myself, are pretty similar in our thought processes with lifting brows with thread lifts. So talk a little bit to everyone about that as well.
Stephanie and I are both kind of laughing when we were talking about bringing on the threads in the office that we both were not a huge fan of brow threads. And then when our trainer that came in and did an updated training, she said the same thing. I think everyone that's done threads long enough have had the same experience where our goal is to get a natural looking result, right? This is not natural anymore. Fortunately, it's not as much of a trend as it used to be.
I can't say that we've been asked a lot, but I see it a lot on social media.
20-year-old girls coming in and saying this, and it just, it doesn't last as long as people would like. So for the expense and the procedure going through that, over time, when something isn't natural or put where it's supposed to be, your body's not going to maintain that.
That frontalis muscle, which is a forehead muscle, is so incredibly strong. Even if there's neuromodulator on board, that I just think the duration of it. Even if you guys are so sophisticated, I think you can give sort of mild results rather than these crazy fox eyes that we were seeing on social media. But I just, like you guys agreed, I just think the duration of that. There's other things we can do for brow. We can help with a chemical brow lift, which is using neuromodulators and toxins to help with that. You guys are both experts at adult therapy. We have that as an option. We have M-Face as an option. So I think we've got things that are more regenerative and are regenerating like our dermis and regenerating our muscle that are a little bit just more natively natural in restoring brow position rather than doing some of these extraordinary things that are, I think, exaggerations of life. Because my approach, and I know you ladies are as well, is just we want natural results that look like themselves, and we are just kind of restoring and people just feeling really confident about the face that they're looking at in the mirror instead of having to do this. So I love that. I thank you for being such a wealth of knowledge, and we're so excited that we now have these PDO threads. Both you and Stephanie, I mean, I think are true gifted hands in applying these, and that was very evident when we were doing our fun, like really sort of training. So all the staff got to see you guys at work working on our patients, and we'll have some of their before and afters because we want to wait until they have their third session. So I think that'll be so exciting to be able to showcase that on some of our before and afters. But
are we allowed to announce that we're going to have an event?
Yes, so we're going to look at dates. We're going to do a little lunch and learn. So we'll keep it more intimate. We want people to be able to feel comfortable and ask Julia and Stephanie questions. But look for that. We're creating marketing collateral now. It'll probably be on a Wednesday or Thursday around lunchtime. But we will actually do kind of a talk so you guys can have an opportunity in person to talk to the providers that are real experts at this, and learn more too. So look for that. We'll definitely send out a newsletter. It'll be on our website. We'll put it on our social media channels once we have it. But that'll be either later in October, maybe early November. That we showcase some of that too. Yeah. But thank you, Julia, so much. I love this, and we're going to have more. I think it's so nice to talk about these topical things, and we're so busy in clinic. This is like nice because we actually get to spend more quality time with one another. But if you have questions, we've got lots of information on our website. It's artskinmd.com. We are closed over noon, but if you guys do have questions about the thread list of PDO lifts, you certainly can schedule a consultation with Julia or with Stephanie. We're already performing them, and our phone number is 858-792-SKIN, which is 7546. So I want to thank you guys for attending, or if you're watching after the fact, and we'll have lots more education to come from Artskin MD. Thanks, Julia.
Thank you.
That's great.